Please, my name is Francis. And
My name is Aaron.
all right, thank you very much. So, as part of the Medical Students Health Week celebration, you went outside today to educate the people on cervical cancer and HPV. So, we want you to tell us something small about the HPV virus and then the cervical cancer in general.
Okay, so most definitely we know the sweetness is in the pudding. HPV is human papillomavirus, and it's a virus, and it's the main cause of cervical cancer. There are so many strains of HPV viruses, but there are a few that causes cervical cancer. There are others that causes genital herpes and others. So there are a few strains that causes cervical cancer. And the most important thing I want people to know is that the HPV virus doesn't just affect women, as in the cervix, but also affects the throat, whether it's in male or female. It affects the anus, whether it's in male or female. This is because in the change of things, you know now that there's a lot of anal sex going on, and that is something that we can't dispute. There's a lot of oral sex going on. So throat cancer is on the rise, anal cancer is on the rise, and another important part for our male is penile cancer. That is cancer of the penis is also on the rise. So it is important that it's not just for the women, the male should also take active interest in this. And I believe if the male also take active interest in this, it would help our female and help ourselves as well.
Yes, thank you very much. I think I was talking to someone about it, and the person was asking me, so why is it that if they still use condom to have sex, I was telling them that even if they protect themselves with condom, they are likely to get it, but they were like, how? So I want you to maybe tell us, why is it so possible that even if you use condom, you still end up getting the HPV virus?
So it's the HPV virus just by contact. You get it, it's just by contact. Condom has a percentage of reducing sexually transmitted infection, most definitely. You get it, but it's most definitely not 100%. And as we already said, oral sex is happening. Anal sex is happening. So are people wearing condoms for oral sex? That is a question. That's a huge question. That's a huge gap. Do you get it? So if you are not getting cervical cancer and you are getting throat cancer still from the HPV, it is a virus that is thriving. Do you get it?
Yeah. Thank you very much. So what would be the advice for anyone out there? Maybe some people will be like, I'm waiting when the symptoms come out before I go to the clinic or hospital. What would be the advice for these individuals?
So the virus takes a lot of time before it eventually becomes a cancer. So it is important to get tested as soon as possible. And when you are tested and it's not full blown, it hasn't gotten a point where it has become a problem, it can be cured. Do you get it? And aside that, if you are negative, if you don't have the HPV virus, then straight away you get vaccinated, because it is the only cancer that can be protected by vaccines.
Thank you very much, please do. We really appreciate your time.
I really appreciate you too. Thank you very much.
Right. Please, my name is Francis. What's your name?
I'm Henrietta.
All right. Thank you very much for giving us the opportunity to talk to you. So as we all know, we stepped outside today to educate people on HPV and cervical cancer. So I want you to tell us something more about the HPV and the cervical cancer.
Okay, so I would say that HPV is a very dangerous virus and it spreads fast. So HPV, people just sit down and they don't go for checkups and all that. And if you do that and wait for the symptoms to show, some people the symptoms didn't show, but they still wait. So I think people should go for regular checkups as well, because HPV can also lead to cervical cancer. And with cervical cancer, it can also lead to infertility issues as well.
Thank you very much. So if somebody asks that, maybe I don't know, I want to know whether I have the HPV or cervical cancer, what should I do? I don't know anything about it, so what should I do?
So there are health screenings. If you go to the hospital, they can even check for you. And right now at CCTH, there's a free health screening going on. So people can just pass by CCTH, those in Cape Coast. And then you can visit any health center or hospital nearby to go for a checkup so that you will know whether you are also positive or negative for cervical cancer.
Thank you very much for your time.
Thank you.
All right, please, my name is Francis and you.
I'm Beatrice.
All right, thank you very much for giving us the opportunity to talk to you. So we all know that this week the medical students here went out to educate people on HPV and cervical cancer. So I want to ask you anything you want to tell the people watching us about the HPV and then the cervical cancer.
Okay, so what I know about HPV is actually human papillomavirus, and it can be transmitted through sexual intercourse. Yes, and also it's the number one cause of cervical cancer recently. Yes.
All right, so thank you very much. So you made mention that it can be transmitted through sexual intercourse. Is that the only cause of transmission?
Oh, okay. It can also be gotten through blow. I don't know what to say. Is it blowjob or what?
Sure, thank you, man. But if somebody is out there, somebody will be like, okay, I'll wait when the virus or when the cervical cancer starts showing symptoms before I'll go to the clinic to do the screening and all those things. If you get opportunity to talk to somebody like that, what will you tell the person?
Okay, what I will say is that if you are a female and you know you relate, you get involved in sexual intercourse, you need to get screening quite often to check. You don't need to wait for the symptoms to proceed before you start getting vaccinated.
Thank you very much. Where can they get those screening and the vaccinations?
Okay, I think in the hospital.
Thank you very much for your time. Please, my name is Francis. Can you tell us something about yourself?
Okay, so I'm Gideon Osayanani, a level 200 physician assistant student, and the SRC representative for Superannuation Hall UCC. Yeah.
Thank you very much for the opportunity for us to talk to you. So today we went outside to talk to people about HPV and cervical cancer. So I want to ask you, what do you know about the HPV and cervical cancer, or what will you want some people, anybody watching this video to know?
Okay, thank you for your question. So this is a Health Week celebration by UCC School of Medical Sciences in collaboration with the physician assistant students. And as part of the Health Week, we went out for a health walk, which was a campaign about HPV and AIDS-related infections. So though our focus was on cervical cancer, letting the people know how they get infected, the transmission, the effects of the HPV and some of the other infections.